Hi, this is Hallicrafters Rehabs. Welcome back. Today my gerontology moment is actually a complaint. Well, not about my father. We just finished up another couple days there, and he did fall. No injuries, and I was on duty that night. And there was, we were all in good spirits and no issues, but he was too afraid to let me get him up, so I pulled a chain and they came down, and they were very nice to get him up and back into bed. And he actually got up again later with no problem, so it's going to be like that for a while. We've gotten to the point where we're ordering a pressure pad that will alert us if he gets up in the middle of the night. We can watch him and make sure he's safe when he wants to go to the bathroom. But he's 100, World War II veteran for those of you. This little video is not going to be a normal one, and so there may be some folks that see this or don't realize that I restore radios, and that's what I do on this channel. But I also throw in a gerontology moment. Gerontology? Okay, whatever. Because with my experiences with my dad. So he's being 100, we're doing everything possible to keep him out of skilled care, because if he were to go into skilled care now, he would, we might as well just go ahead and have the funeral. He can come to the funeral, we'll enjoy the music and the eulogies, and then we'll say goodbye to him and we'll never see him again. This is my wife's mother, my mother-in-law, Zola. Actually, this picture is she was a lot less sick than she is now. She's in the last maybe weeks or possibly months of terrible, debilitating disease of Parkinson's. And we won't see her again, though they may bring us in the last few hours while her blood oxygen level is falling and that kind of stuff, but we can't see her regularly. June gets to see her once a week on FaceTime, and Zola is really unable to recognize that that's what's going on. Whereas if June were there, it would be different. And this is June's youngest sister, and she is a diagnosed schizophrenic, and she also is in solitary confinement, seeing only the staff and unable to really mingle. She's a huge extrovert, knows everybody, and talks to them all the time, but she has to stay in her room, and they bring her food to her room because they're afraid of the coronavirus. So this is a complaint, and the complaint is this, that we are killing our nursing home residents, our elderly, our parents, our uncles, grandparents, whoever they are, with loneliness. And we're killing them with loneliness because, and we have I get an email every week, or even more often than that, from the nursing home. Oh, we've had no positive cases of coronavirus here. Oh, well, that's wonderful. They shouldn't. It's a sterile environment there. Might as well be assembling parts for equipment to roll around on the moon or something. And we certainly couldn't have us pig pens coming in with all our viruses into this sterile environment and visit our parents or our aunts or uncles or things like that. Because then the virus would be there and everybody would die from that. So the problem is the issue is neglected. There is no advocate for the families. There is no advocate for the inmates in solitary confinement, semi-solitary confinement. Window visits is the big thing. Well, that's not a visit. I mean, thankfully for a couple in our church, that window visit is something. But we can't even hold the nursing homes accountable by the presence of family or sitters right now. And what's the cause? It's not the virus. Well, this is only temporary. No, it's not. We've learned a lot from the coronavirus measures. And you can bet the farm and then go and actually first go mortgage the farm. Don't tell them that you're betting the farm. Take the mortgage proceeds and bet that too, and get a double payout. And the requirements that they're under right now are not going to be relaxed significantly because, prior to coronavirus, there was norovirus. And they carried out people dead from that. And before that's flu. And there'll be another round of flu. And there'll be another round of noro. We got to keep these. We now know how to keep everybody safe from disease at these places. Isn't that wonderful? And safe from their family, and safe from their relatives, and safe from accountability from them seeing their family. So the root cause is not the disease. The root cause is not the big bag nursing homes. The root cause, these are all factors, but they're not the root cause. The root cause is not the government that is still trying to figure out what the right things to do for this virus is. I don't blame them. I don't blame anybody, actually. The root cause is this. When everybody was chased out who wasn't a staff member of these places, family, sitters, feeders, things like that, the staff went down. The staff was actually depending on that. And the staff hasn't gotten any larger because the revenue base, as far as I know, I doubt it's changed, has not changed. So you add a whole bunch of requirements on the nursing home because, we're in an emergency right now. But you don't give them funds for, say, maybe more staff or some PPE so visitors can come, or training for visitors so that they could come and with their pigpen viruses and, pigpen. All the viruses just falling right off of us. So, so the real issue is that I don't see this ever changing much. Maybe it will. Now, when the vaccine comes, then there'll be another pandemic. I mean, viruses are pretty regular. There are billions of them out there. This is just novel that it hopped onto people and is highly contagious among people. But there will be others. There will be another flu epidemic someday, and on and on. And the other thing that will happen is that all viruses weaken. They all do. If they didn't, we wouldn't be here. The first virus would have wiped out mankind. So they do weaken. What we need is an advocate for the inmates in these places, and for the families that are isolated from their spouses, their parents, their grandparents, aunts and uncles, that can't take care of themselves, so they need the place, and now can't visit anybody. The TVs don't do the job. FaceTime doesn't do the job. Zoom doesn't do the job. Nothing does the job. But personal contact, actually, that does the job. So that's my old person, I forgot the exact spelling, gerontology, the study of old people. I'm an amateur gerontologist. Okay. That doesn't mean I don't take geritol on an amateur basis. It just means I study old people because I have to. I'm looking after my father. And that's my moment. And I'll probably just keep this as a separate video and get back to my radio restoration in the next. Let me just add one other point about killing our elderly with loneliness in the nursing homes. It's just this. It's not anybody's intentional thing, but the fact of the matter is that when you get the age of my father, he doesn't have my kind of appetite. You put a plate of food in front of me and I'm licking the juice off the bottom of it. But he has to be reminded to eat. He doesn't have an appetite of the kind of appetite we would have normally. And so he eats best in a social situation with family. We took him out to a restaurant, 100-year-old out to a restaurant with social distancing yesterday, or the day before yesterday. And still we had to remind him, eat your spaghetti. And so the loneliness, if he were by himself, and we know this, the CNAs that attend to him, they can't get him to eat. But most of the time, I can get him to eat. There's just no there's no way around that. And it's not because they're incompetent. They are very competent. They just can't. They're not family. We're not having a visit. And so while loneliness leads to starvation, and that's how they will die. Thanks for watching.